Hello and welcome to What Happens Next, a series curated as part of Sahas's ongoing endeavor to support survivors of gender-based violence and active bystanders with information toward empowered decision-making. In today's conversation, we're going to look at what a survivor can do in terms of their options once an incident of gender-based or sexual violence has confronted them. First and foremost, as always, after an incident of sexual or gender-based violence has taken place, a survivor is not in any way diminished or reduced in their entire personhood and dignity. You as a survivor remain in control over your choices, your decisions, and your exercise of your agency. Nobody can tell you to do what they think is appropriate for you, and nobody can question your decisions to do or not do something in response to what has happened to you. At all points, accessing the right kind of information to support your choices is ideally useful for you in order to make sure that any decisions you make come from a free and full exercise of your agency. Following an incident, the first option you have in terms of deciding for yourself is whether you want to disclose the incident in itself. Disclosure refers to the act of telling someone, and it could be anyone, your friend, an acquaintance, a doctor, a lawyer, a therapist, or even a bystander on the street about any incident that concerns you. To disclose or not to disclose is an act of your agency, and you have full freedom to exercise your agency in deciding when, how, what, and if you will disclose an incident of sexual or gender-based violence that you faced. Much like the idea of consent, disclosure is also entirely up to you to frame. How will you express yourself if you choose to? To whom will you express yourself if you choose to? When, to what extent, and exactly what medium you will use to do so? And all of these questions are entirely within your domain to exclusively decide. If you choose not to disclose an incident, that's a decision you have entirely full freedom over, and you can change that decision at any point in the future. Should you make a disclosure, you also have a right to control how much that information transmits beyond the person or persons to whom you make that disclosure. The second thing you may choose to do is to report or not report the incident. Unlike disclosure, reporting has an extra layer where you speak to somebody in a position of authority, where they have some sort of a systemic backing to take action on what you have shared. Reporting could be made to the police, to the legal system, to a medical provider or a therapist. And what that report turns into is well within your purview to determine. In some countries, you have the option of just reporting the incident to the police and asking them to hold on to that information without pressing charges. In most countries, this is called an incident report, and it's available to be accessible for you on the police records should you want to press charges later. In some countries, there may be a limitation in terms of how soon or how late you can prosecute a crime of sexual or gender-based violence. Now, the laws and the legal systems of each country typically determine what happens next when you disclose and report an incident to a person in authority. One thing to remember before you make a decision on whether to report an incident or not is that the process, the legal process, once set in motion, may require you to go through several iterations of recounting the incident, both to the police, in subsequent investigations, and in the court. And these incidents and the recalling of those incidents can be traumatic at different points in time. It's useful to really think through some of these rules and expectations of you from the system before you make a decision to report an incident. The third thing you can think about is to make a safety plan. A safety plan is a mechanism that you can rely on to make sure that you have all the resources, the support, and the routes you need to stay safe. In general, in itself, a safety plan is a good idea. But when you are vulnerable, it is highly recommended. It simply involves identifying a safe route for you to escape a difficult situation, making note of the people you will call on should an incident happen, and even packing a bag of safe resources and things that you might need if you have to escape an abusive situation. Choosing to stay on in a situation that is abusive does not diminish your rights and does not mean that you are consenting to abuse. To stay, to not stay, and the dynamics of what it means to do or be involved in both situations are highly contextual, and your agency is not in any way eroded simply because you choose one over the other. Keep aware of all the information and all the resources that you need to be able to access should a situation require you to step up and take action in ways that prioritize your needs. You may choose to also access medical and psychosocial help. Depending on the level of violence you faced and the extent of your injuries, you may or may not choose to visit a doctor to get those injuries looked at and addressed, potentially with medication or other forms of intervention. It is also helpful to access therapy in the aftermath of violence to deal with the trauma caused by that act of violence through either a counselor, a psychiatrist, or a trained trauma-informed therapist. In most countries, reporting opens up the path for access to both medical as well as psychiatric and counseling support. In cases where medical exams are done after an incident being reported, you have to also submit that piece of evidence to the court of law if you choose to press charges and prosecute the incident that happened to you. However, should you choose not to prosecute the matter, you are still entitled to a medical exam, still entitled to receive medical support, and still entitled to receive counseling and psychiatric support. In order to press charges, should that be something you want to think about, within 24 hours of the incident having taken place, avoid bathing, taking a shower, or washing yourself, and avoid bathing or dispensing with items of clothing in any way within 24 to 72 hours. Should you wish to press charges, now if you wish to press charges, it is usually advisable to avoid bathing, showering, or washing after the incident of violence has taken place, because this may take away some of the key pieces of evidence that can be used to build your case. So it's usually helpful to stow away clothing, items of accessories, or any other items that you had on your person that could constitute evidence into neat bags and keep them aside so that it can be transmitted to the investigation authorities soon after, and to avoid washing, bathing, or showering after an incident. Healing is not a formula, which means that if somebody had faced an incident and they went to a therapist and recommended a therapist or medical service provider to you to follow through, your journey can look intensely different from the journey of another person. So it's important to also bear in mind that your own individual circumstances will also dictate what kind of help would be most important for you at what point in time. You may also seek legal advice if that's a course that you wish to pursue. Some folks choose to press charges right away, some choose not to do so, and both are perfectly okay. But to be able to make that decision in a free and fully informed fashion, it always helps to know what your rights are under the law and what would happen should you wish to press charges or not press charges. Speaking to a legal helpline or to a lawyer is highly recommended in such situations. Finally, you may also choose to move out of the place, the city, or the region where the incident happened. And if that works in your favor to prioritize your peace of mind, your emotional wellness, and even your physical wellness, doing so is perfectly well within your right. These are just some of the potential interventions and support resources you can rely on in the aftermath of sexual and gender-based violence. Always remember that your agency is key and you are the master of all decisions you choose to make. You do not owe anybody an explanation for why you chose a particular course of action, and you cannot be guilted or shamed into taking a particular course of action that feels uncomfortable for you to follow.